All right, this is part two of looking at addiction, and I like a lot of the slides in this particular lecture. So, this comes from the American College of Lifestyle Medicine, and this is a group that I belong to. I really think it's an important group because they're trying to look at different ways of addressing chronic health conditions in our population. A lot of primary care providers and medical doctors involved in it. And so, again, as PTs, as occupational therapists, we are going to be working with patients that have these substance use disorders. There's some treatment stuff in here, but I'm going to be kind of talking about that within the context about how certain things, how they might be applied by those primary care providers or psychologists. Like this quote here, no one cares how much you know until they know how much you care. And so I think that ties in with substance use disorder. Now, as we go through things, there's going to be some slides that I'm not going to talk about. I'm going to skip over. I'm just going to say kind of skip or let's go past that one because they're not really um, relevant to our discussion. They may get into pathophysiology a little bit deeper than we need to go or other areas like that. So, addictions are found in the DSM 5. There's the substance related and addictive disorders. So, you've got tobacco, alcohol, opioid, and caffeine. I guess I got that one. There's non substances related disorders like gambling, conditions for further study like internet gaming disorder. And that one I definitely think is a challenge for young individuals. See this all the time where they are up all night long and just absorbed within that world. There's the binge eating disorder, and there is non substance addictive behaviors, gambling disorder, the other conditions like the internet gaming disorder. The Chinese government apparently has labeled it an addiction. Other conditions considered hypersexual disorder, sexual addiction and compulsivity. Exercise can be a non substance addictive behavior, shopping, and food or eating. Looking at alcohol, there is the quote unquote good and the bad. The question is related to the good. Is there health benefits? And one challenge is if you look at the research, sometimes there'll be research that suggests health benefits from red wine or the consumption of wine. Other times they'll say that there's no benefit. The bad is related to the matter of quantity. So, how much are the recommendations? One drink for women, two drinks for men. And that's because women have less alcohol dehydrogenase in their stomach linings and thus metabolize only a small amount of alcohol in their stomachs. The rest goes into the bloodstream. Thus, alcohol in women has twice the effect as that in men. Recommendations: if you don't drink, don't start. If you drink, limit yourself to one drink at a time for women and two for men. Let's skip through this one here. Alcohol serving sizes. So, one beer is equal to 8 to 9 fluid ounces of a malt liquor, 5 fluid ounces of a table wine, and a 1.5 fluid ounce shot. What's binge drinking? That is consuming 5 or more drinks in about 2 hours for men or 4 or more drinks for women. So, your young college-aged individuals, but also too, it could be anybody of any age. The CAGE questionnaire. Have you ever felt you should cut down? Have people annoyed you by criticizing you for your drinking? Have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves or to get rid of a hangover? Scoring. Item responses on the CAGE are scored 0 to 1, with the higher score indicating alcohol problem. A total score of 2 or greater is considered clinically significant. In 2018, how many adults 18 years or older reported that they drank alcohol at some point in their lives? 86%. What percent drank in the past year? 70%. What percent drank in the past month? 55.3. So it is a big component of our everyday lives here in the United States. Major nationwide survey of 43,000 U.S. adults by the National Institutes of Health show that only about 2 in 100 people who drink within both the single day and weekly limits below have alcoholism or alcohol abuse. So what that's showing is that if people are drinking moderately, then they aren't having the diagnosis of alcoholism or alcohol abuse. Now, this is interesting here, this particular slide. Now, this again comes from the American College of Lifestyle Medicine. The recommendations are 2 or fewer drinks at a time. So this is interesting how it's saying any single day 4. See, 2 would line up with 14. So I'm wondering where they get this from here, that 4 and that 3. So here is more information on that. 4 drinks on any day or 14 in a week. 3 drinks on any day or 7 per week as being at-risk drinking. Okay, that's what that is. These are the at-risks. Well, this is saying less than. Okay, kind of interesting there. Kind of awkward with how it's written because, again, the current recommendations are 2 or fewer for men, 1 or fewer for women. Here, at-risk drinking then is more than 4 or more than 14, women more than 3 a day, and more than 7. The more drinks on a day and the more heavy drinking over time, the greater the risk not only for alcoholism and alcohol abuse, but also other health problems. Alcohol use disorder, a problematic pattern of alcohol use leading to clinically significant impairment or distress, as manifested by at least 2 of the following occurring within a 12-month period. Alcohol is often taken in larger amounts over a longer period than was intended, and there's persistent desire or unsuccessful efforts to cut down or control alcohol use. Great deal of time is spent in activities necessary to obtain alcohol, use alcohol, or recover from its efforts. There's a craving, recurrent alcohol use resulting in failure to fulfill major role obligations, continued alcohol use despite the persistent or recurrent social and interpersonal problems caused by it. Also, important social, occupational, and recreational activities are given up because of alcohol use. Recurrent alcohol use in situations in which it is physically hazardous, and alcohol use is continued despite knowledge of having a persistent or recurring physical or psychological problem that is likely to have been caused or exacerbated by alcohol. Alcohol tolerance is a need for markedly increased amounts of alcohol to achieve an intoxication or desired effect, or a markedly diminished effect with continued use of the same amount of alcohol. Alcohol withdrawal is the characteristic withdrawal syndrome for alcohol, or alcohol or a closely related substance such as a benzo is taken to relieve the withdrawal symptoms. Criteria here for alcohol withdrawal. I'm not going to read through these, so if you want to pause the recording, I'm going to give 5 seconds of dead air. Alcohol intoxication due to recent ingestion of alcohol. It's a clinically significant problematic behavioral or psychological set of changes that develop during or shortly after alcohol ingestion. One or more of the following signs or symptoms are developed during or shortly after alcohol use. The signs and symptoms are not attributable to other medical conditions and are not better explained by another medical disorder, including intoxication by another substance. Treatment options: Alcoholics Anonymous, different secular organizations for sobriety, Smart Recovery, Women for Sobriety, working with a mental health care professional like a psychotherapist or psychologist, and inpatient rehabilitation programs. There are FDA-approved medications. Obviously, this is coming from a provider and not us. Alcohol can have significant impact on health, so it can cause memory-related issues and lead to a blackout. There can be symptoms of Wernicke's encephalopathy, include mental confusion, paralysis of the nerves that move the eyes, and difficulty with muscle coordination. Thiamine deficiency, Korsakoff's psychosis. There can be damage to the heart, to the liver, cardiomyopathy being one of the things causing heart damage. Cardiomyopathy was a cause of a death of, drawing a blank on his name and his band, but he had that song for the Shrek movie. I think it was Walking on the Sun. He died in the past year. He had cardiomyopathy, and he had a history of chronic alcohol use. Another famous musician, Slash, the guitarist, he recovered from cardiomyopathy. I think his was in the early 2000s or 2010 time, somewhere around there. And he is, according to the articles I've read, his life was at risk too because of alcohol use. Can cause pancreas damage and impact the immune system. Development of certain cancers are increased. The risk of them are increased. All right, let's look at cannabis or marijuana. Again, according to this kind of slide here, which was published in 2021, most commonly used illicit drug in the U.S. Although, how illicit is it anymore when most states have it legal? So the individual gets quote unquote high from its use. There are carcinogens present in all smokes, though, all forms of smoking, whether it's tobacco or cannabis. Um, Medical marijuana has been approved to treat nausea and vomiting associated with chemotherapy. And I think there's also approved uses for, it's like not a gel, but some sort of roll on for, maybe it's an oil version of it for seizures. Looking at impact upon health. In the last lecture, talked a little bit about it. Here is some other information: increased risk of heart attack, expanded blood vessels in the eyes, so the bloodshot eyes, increased blood pressure and heart rate, breathing problems, problems with child development, relaxation and enlargement of breathing passageways, short and long-term effects on the brain, and impaired body movements, also altered senses and sense of time, anxiety, mood changes, and depression. Sometimes you'll hear people talk about, I'm using marijuana to help with my psychological condition, but the chronic use of marijuana can also contribute to that or worsen it. Difficulty with thinking and problem solving, impaired memory, suicidal thoughts, and the reduced life satisfaction. Looking at tobacco, obviously nicotine, there is a tobacco use disorder, problematic pattern of tobacco use leading to clinically significant impairment or distress, as manifested by at least two of the following occurring within a 12-month period. Tobacco is often taken in larger amounts over a longer period of time than was intended. There's a persistent desire or unsuccessful efforts to cut down on its use. Great deal of time is spent in activities necessary to obtain tobacco, use it, or recover from its effects. A craving or strong desire to use it. Recurrent tobacco use resulting in a failure to fulfill major role obligations at work, school, or home. And continued tobacco use despite having persistent or recurrent social or interpersonal problems caused or exacerbated by the effects of tobacco. Other aspects of tobacco use disorder: somebody may give up important social, occupational, recreational activities because of needing to use tobacco. Recurrent tobacco use in situations in which it's physically hazardous, such as smoking in bed, or tobacco use is continued despite knowledge of having a persistent or recurring physical or psychological problem that is likely to have been caused or exacerbated by tobacco. So, tolerance of tobacco use, there is potentially a need for markedly increased amounts of tobacco to achieve the desired effect, or a markedly diminished effect which continued use of the same amount of tobacco occurs. Tobacco withdrawal can take several weeks if somebody's been using on a daily basis. Irritability, anxiety, difficulty concentrating, increased appetite, restlessness, depressed mood, and insomnia are all side effects. Risks associated with smoking include risk of coronary artery disease, stroke, increased risk of lung cancer. According to research, even smoking 5 cigarettes a day puts you at an increased risk for signs of early cardiovascular disease. Smoking will damage blood vessels. So it will cause endothelial lining damage, which can then allow the formation of plaque to occur and lead to coronary artery disease or ischemic heart disease. I think we're all familiar with smoking and lung disease. A relationship there. Smoking also contributes to the onset of many cancers. The FDA has approved medication for quitting smoking. Who starts smoking? Teens. 90% of smokers start before the age of 18. People who have parents or friends who smoke, or they just wanted to try it, or they thought it was cool. Anyone can become addicted to nicotine. The younger someone is when they start smoking, the more likely they are to become addicted. More than 7,000 chemicals, including hundreds that are toxic and about 70 that can cause cancer. So secondhand smoke is a major problem too. And that's why, of course, I think it was during the 80s, many bars, restaurants banned smoking within the establishments, or many states required bans so people could not smoke. And then, of course, those smoking bans were then implemented in all places in order to protect those individuals who weren't smoking in those settings. Secondhand smoke does increase risk. Non-smokers who are exposed to secondhand smoke increase their heart disease risk by 25 to 30%. It's estimated that secondhand smoke exposure caused nearly 34,000 heart disease deaths annually between 2005 and 2009 among non-smokers. Stroke is caused by exposure to secondhand smoke. So there's a recognition or relationship there. Let's finish up talking about opioids. 116 deaths daily from overdoses, according to this 2021 paper. Opioids can cause drowsiness, confusion, euphoria, nausea, and reduced pain. Other addictions, let's see, skip through that. Okay, so I want to just briefly talk here because we aren't going to be involved with the counseling of patients, but something that kind of ties in with any type of behavioral change is understanding where people are at. And that's using the trans theoretical model. And with the trans theoretical model, you've got pre-contemplation, contemplation, preparation, action, maintenance, and termination. So pre-contemplation, somebody's not even thinking about making it a change. Contemplation, people are starting to think about. Preparation, people are maybe putting some effort into kind of learning about the process or exploring how to make changes. Action is the doing. Maintenance is then the continual doing of that. And then termination is if somebody were to stop it all. You can kind of think about behavioral change being applied to anything, like starting an exercise program. Some people don't even think about exercise, and then maybe they're like, maybe I will exercise. And then, okay, well, if I'm going to exercise, how would I like to do it? Well, maybe I like to walk and I need to get some shoes and this and that. And then finally they get those things and they're doing it. And then they do it over a period of time. They're maintaining that behavior. And then throughout life, sometimes we stop doing something. We can always get back on. But this is basically the different stages according to the trans theoretical model. And what we do as practitioners, or at least what they're trying to talk about here, is, and this is what I teach at George Fox, is some motivational interviewing. So when somebody is wanting help, or let me put it this way, if I were to tell you I want you to stop smoking, if I'm your doctor, if you don't have a desire to stop smoking, me telling you that is not going to get you to stop. But if we have a conversation, if I say to you, hey, I know you like to smoke. I'm curious. Are you open to talking about smoking cessation? So you're asking for permission from the patient to be able to talk about it. And if they say, yes, I'm open to talking about it, that opens the door to doing some of these things. If they say no, I'll say, okay, I'm here for you in case you ever do want to talk about stopping smoking. Because, if you just give them a medication prescription to help with stopping smoking, they're not going to fill it, they're not going to use it. Somebody has to want to make the change. And then what helps people make that change is finding out why. Tell me why you want to make that change. Oh, you want to have better health. Why is your health important to you? Well, my health is important to me because I'd like to see my grandkids. You get joy from being with your grandkids. Yes, I do. I love being around. So you're asking these questions, and then you're also using reflective listening, affirming, and summarizing to really get to that aha moment, that generative moment where the person's like, yeah, okay, I think I can make a change. I can do this. And then you start working with them on developing some goals. And this all kind of ties into that, being empathetic, align with the motivation. What's going to help them build their confidence that they can do it, set a goal, and then follow up. So get that accountability. And one thing that, when you're using like motivational interviewing, it's changing the mindset from being the expert, or in this case, the person wrestling and dominating, being in charge, to being a dancer, working in tandem. Or another way of thinking about it is you're walking side by side with that patient towards their goal. You're helping to facilitate it. So it's a different mindset from being the expert to the facilitator. So that's a lot of what, or let's just say a component of addiction medicine. There's the medicine side, but then there is that human side, the psychological intervention. Again, we probably don't work in that area at all. We shouldn't. You could potentially, if somebody trusted you, you could do some motivational interviewing and talk with them and so forth. I wouldn't want to label it as treatment. I wouldn't want to get to the point where I was establishing goals with that person. But if I could help them to maybe find that motivation to make changes, then get them hooked up with somebody who is educated on how to do that, would be really, really valuable. All right, I think that's everything I wanted to kind of talk about in this particular PowerPoint. All right, great. Let's go ahead and end there.